Hey, so I have with me today Nashley Brogan, AUD, probably the coolest and smartest audiologist up in Canada. And really today, I want to talk about the Hearing and Cognition Summit that we are hosting in Ontario, June 9th. Nashley, why are we doing this? Because you're the driving force behind this.
Because in Canada, we have a lack of information and education on cognitive health and hearing health and how the brain impacts our cognitive health. And a lot of audiologists and hearing providers are interested in cognitive screening, but we don't have the educational events. We don't have the education. And I had to travel down south with my team. So I thought by bringing your phenomenal training and Dr. Douglas Beck's and Terry's up to Canada, we would be able to provide that education for Canadians who are interested in the brain hearing connection, interested in cognitive screening.
So let's talk about that. Who is coming, right? Because you and I met and we're like, we've got to get the best of the best together. Full day event. We're talking 8:30 to 5 p.m. That talk about the speakers and the way you see the day shaping up.
Oh, well, the day is phenomenal. So Dr. Douglas Beck will be starting with audition and hearing. So he'll be talking about how our brain hears, the connection to it. And then we start going into the aging brain and how our brain ages. And obviously, as audiologists and hearing providers, that's something we're interested in because most of our clients and patients have aging brains. Then we start talking about comorbidities and hearing loss and how it's related back to what we do in decline and dementia. And I think then obviously the next logical step is cognitive screening and how that ties in. So Dr. Douglas Beck will be doing the audition and hearing aspect. And then, of course, you yourself talking about preventing decline in brain and bringing the whole neuroscience. And then Dr. Terry Edwards will be talking about the clinical implementation of neuroscience in your practice. So how to use those words with your patients, how to talk about it. And Dr. Edwards has been a clinical audiologist for many years, and she's so passionate about teaching the patients about, you're in background noise. We don't just want to say to a patient, hey, you can't hear in background noise. We want to say what's happening in the brain so that you're having trouble hearing in background noise. And that's where Dr. Edwards will be talking about. So I think we go from everything from the brain connection to the decline, the dementia, the cognitive screening, and then also in the neuroscience. So it's a lot of information in those couple hours. And I think the three speakers bring it all in, but very different perspectives from a researcher to a neuroscientist to an audiologist.
I got to tell you, that's what I'm most excited about, right? So we have Dr. Douglas Beck. Everybody knows him, right? And his thing has always been, how does hearing impact the brain, right? And I think before you get into disordered, you really have to understand the connections of the ear to the brain, how audition influences cognition. And once you know that, it makes sense. I mean, seriously, it makes perfect sense that as audition declines, the demand on cognition increases. And that extra demand is what leaves our patients at risk for cognitive decline and dementia. And then I'm going to sort of take over and I'm going to say, okay, that's great information. Now that you're on board, I'm going to dive you in. I'm talking at the literally microscopic level, show everyone exactly what happens in the ear, exactly what happens in the brain. Because look, our patients essentially suffer with the same symptoms, right? Whether it be clarity, hearing in background noise, tinnitus, hyperacusis, and memory problems. And all of that is very easily explained by the actual pathophysiology of what happens as we get older, right? So I actually just look at aging in general, and then we'll throw in, well, what happens if there's noise and ototoxicity? Because if you're going to treat patients, you've got to understand what's actually happening underneath, what's actually happening inside. And then you're right, we take all of this science. I sort of joke and say it's like the 30,000 foot level, right? Like Doug starts us out at a cruising altitude, and then we're just going to keep getting deeper and deeper and deeper and come down to the 5 foot level of, okay, how do you incorporate this knowledge into the case history? How do you ask the right questions so that you can dive deep into the 5 symptoms, so that you can dive deep into your patient's cognitive health? Then, and this is always my favorite, I call it moving beyond the beeps, right? Because the last thing we want to do is be relegated to air, bone, and speech. There's so much more we can do. And so I always love to share our 7-step process what we call best practices for cognitive screening and diagnostic assessment of hearing loss and tinnitus. And we're going to dive real deep, right? We've got like 2 hours, I think, on this topic so that you can start to figure out how to actually implement cognitive health into your testing and screening protocol. And then you talked about Dr. Edwards, right? I mean, nobody's more passionate than Dr. Edwards. Dr. Edwards has been in the thick with everyone, seeing patients for the last 30 years, and really understands that in order to get the patients to buy in on why it's so important, how to get them to say yes to treatment, is to help them understand the why, help them understand why this hearing loss impacts their brain health and what they can do about it. I got to tell you, of all the events I've been a part of, I feel like this is like probably one of the most important events. It's pretty condensed into one day.
It's a lot of information.
But you're going to walk away with a ton of information, right? And I know, right? Because there's been some controversy, especially up in Canada, about cognitive screenings, about cognitive health. But you've said, you know what? Let's put the controversy aside and put the patient first. So what has it been like for you to implement cognitive health into your practice?
Oh, it's been a game changer. We really made our private practice different, and our whole team was on board. So they became excited because they seen the impact that it had on our patients. So for years, our patients would come in, and we knew they had memory issues. We knew they were suffering from things going in the brain, but we didn't have the words. And then once my team became, it's always like we say, confidence breeds confidence, is once they got confident in talking about the brain and they talking about the cognitive screening, and we started implementing it in practice, they got so confident in how we were treating our patients better. Our treatment rates were going up. Our long-term patients coming back, we were able to help them more to talk about the memory and what was going on with their brain. So the entire practice just transformed. And it's been an ongoing journey, lots of education, but it's probably for me one of the most exciting things I've done in the last 20 years of my practice. So, I mean, that's saying something, right? 20 years in hearing, it was always sell a hearing aid, do this, learn how to do objections. And then when we started talking about the brain, it was just like, this is hearing healthcare. Like, this is why I became an audiologist, because I want to help my patients, treat my patients. And that's what this is all about. It's better treatment. It's a better journey for the patients, and it's a better journey for your whole team because you feel like a hearing professional, not a salesman. And I really think that's cognitive screening brought to my practice. We got rid of the sales model and we brought in the whole neuroscience hearing treatment model. Now we're a treatment center, not a sales center, and I love it.
I love it. I love it. I mean, that's exactly what this day is about. If you are looking to provide transformative medical treatment of hearing loss and tinnitus, and you are up in Canada, anywhere, I know it's in Ontario, but I promise you, it's worth the flight. If you have to fly, it's worth the bus, the drive, whatever it takes. It's really important that you start to rethink the way you provide your services. So if you want to increase your value, if you want your patients to see you as the hearing healthcare specialist, not the salesperson, if you want to grow your practice, and Ashley, you are one of many practices who have signed on to this treatment model up in Canada. You've joined the Odd Experts community. We champion private practice, and I'm so excited to share this opportunity with more people, because not everybody is as inventive and adaptive as you, who says, hey, I want to learn about it. I'm just going to get on a plane and go to Scottsdale. I'll do whatever it takes, right? So here's a great opportunity at home.
I think it's just empowering. It's empowering for the practice. It's empowering for the staff. It's so empowering for the whole practice model. I mean, it's transformative for your practice, and it's true hearing healthcare, and that's what it is. It's healthcare in its purest form. And I just don't think practices should shy away from it. I just think they need to learn about it properly, proper education, proper protocol, and you'll be fine.
So, all right. So speaking of learning, for those of you out there, you want to come to this, right? This event is approved by AAA. I know that's the American Academy of Audiology. It is approved by IHS. And right now we're going through the process. And I know it's going to work, but we're going to get this approved by AHIP for CEUs, right? Because it's really important that you continue to reinvest in yourself, invest in your team, give them the opportunity to have the competence and the confidence they need to be a hearing healthcare provider. So here it is. You go to hearingandcognition.com. Look, you might have a team of 8. You don't have to pay for 8 people to sign up. 2 people from your team. If 2 people register, your entire team can come. But if you're just 1 or 2 people, then just sign up for the 1 or 2. But we want everybody, right? And actually, it's not just you and your providers who understand cognitive health. Talk about how important it is that the whole team understand cognitive hearing healthcare.
Oh, it's our entire practice. So our front office training, our audiology assistants, our patient care coordinators have all done the training. And the reason why is they're the ones on the phone, answering the phone. If someone has a processing problem, a memory problem, when they're in the checking in the waiting room now, they're helping them fill out their forms, the case history forms. Like the whole group is aligned with the way we talk and the way we present information. If the audiologist or provider gives a handout to the patient and they call back and ask the front desk, they know what they're talking about. So the whole office is just about prevention now. So you have to have your front office team on board with prevention and preventative hearing care, and that we're a treatment center, because no longer do my front office staff think, oh, we're trying to like sell a hearing aid or sell a widget. They're not doing that. They're thinking we are trying to treat the patients. We are trying to keep them actively aging. We want them to be healthy. We want to stimulate their brain. So when the entire team's in that model aligned and we're all rowing in the same direction, the whole practice vibrates that message. And I just even find with my front office and assistants, like they're just so excited. Like the training was so exciting for them, and they've gotten confident just talking about these words that they never knew before. And it aligns too with the literature around our office and everything. So I think it's important for the whole team to be in it together.
There you go. Hearingandcognition.com. This is June 9th in Ontario, downtown at that big giant Marriott.
You can go shopping. You can go shopping. It's attached to the Eaton Center.
Well, there you go. Come for whatever reason you want. But look, and seriously, what Ashley just said about the entire team coming, I want to summarize that into 2 words, which is culture, right? What's the culture of your team, and mindset, right? So we've got to make sure we have the mindset right, which is we are a hearing healthcare specialty. Hearing healthcare is preventative medicine, right? So we've got to get everybody around that one mindset. And then we have to create a culture wherein your team knows how to convey that information. They know how to talk about it on the phone. They know how to talk about it in the waiting room. They know what signs, what posters to put up, what posters not to put up. They know how to pre-educate patients before they come in. By the way, I'm going to talk about that too, how to educate your patients before they ever even come into the office, so that they know you're different, so that they know you care about their brain health, social, emotional, physical, and cognitive well-being. So it's really going to be a great event. You're going to get science, you're going to get marketing, you're going to get mindset, and you're going to get culture. And I can't wait. I'm super excited that Odd Experts, Champions of Private Practice, we are sponsoring this event. And yes, Ashley will be there. She's going to MC the entire event. So we're going to have a lot of fun. We all know that. Dr. Douglas Beck, Dr. Terry Edwards, and I can't wait to come north.